Thank you so much for this opportunity. My name is Lynda Eze. I'm a registered nurse from Nigeria. I currently live and work in the United States as a registered nurse. I've been a nurse for over 9 years. I studied nursing in the University of Nigeria, Enugu campus, and I've been practicing since then. I've worked in so many specialties in nursing. I worked majorly in the community and in the medical surgical area, and I also worked as a nurse tutor in Nigeria. I practiced for 5 years in Nigeria, and during that time I did a master's degree in public health nursing before I now moved to the United Kingdom. In the United Kingdom, I worked majorly in the medical world, and I also passed my NCLEX. And when I passed my NCLEX in the United Kingdom, I also started mentoring other international nurses that want to pass their NCLEX, and I was working with an organization that does that as a nurse instructor. And then finally, I moved to the United States. Right now in the United States, I've been working for less than a year, and I'm working in a medical surgical telemetry unit. Okay, so I am married with 2 beautiful children, and when I moved from Nigeria to the United Kingdom and to the United States, I moved with my family. It's been both challenging and inspiring, and I believe that it has been like instrumental to my career growth. So the journey wasn't very smooth because like there are a lot of exams to pass, there are a lot of courses to take and all of that, and then getting jobs as well for my spouse, finding schools for my children and all of that. They were all part of the challenges and the journey, but I would say that overall it has been a good and inspiring and experience. So yeah. So first of all, I have a passion for health promotion. When I was studying nursing in Nigeria, I joined an organization called the International Institute for Global Leadership. It's an organization that is founded by someone from the US. So the organization majorly gives books to people all over the world. It doesn't matter wherever you are in the world, and they expect you to read those books, usually leadership books, self-help books, motivational books, and they ask you to read these books and tell them what you are going to do with these books and all of that. So being part of that organization helped me to develop skills and also want to give back to my community, because it's part of the mission of the organization, raising heart-centered leaders that will also that also create social change in their environment. So as a nurse, I had that goal of promoting health in my community. So I had young girls in my community that I was teaching how to live healthy lifestyles and make better choices so that they will be able to complete their school and maybe delay marriage until they are able to go to school, get a good job and all of that. So during that time when I was mentoring these young women, I quickly noticed that most of the things that I was discussing with them or I was teaching, I was promoting, they were picking more on what I was doing. And I quickly realized that if I need to make more impact in my community, I definitely need to develop myself. So that fueled my passion to develop my skills, my career. I went back to school after graduating to do my public health nursing so that I will have better skills and knowledge to actually support the women that I'm mentoring, or to be able to provide more impact in my community. People actually learn from what you do. So if they see me do well in my career or going for things and doing greater things, they will also be inspired to do more for their lives. And that's exactly what happened. A lot of them went to nursing school, to maybe community health schools, going to schools and all of that, and that made me to continue to also strive to be better in my career. I got this master's degree, decided to move to the UK, and then decided to move to the US as well, because that organization I talked about as well helped me to understand, like to meet a lot of people, network with people that are already in the US and in other parts of Africa. And I actually felt that practicing outside Nigeria will give me that connection, that knowledge, that experience to be better, to make more impact in my world. Okay, when I was growing up, I remember that my dad was always going in and out of the hospital, and the hospitals they have around me wasn't like the best, and it was like a very stressful and emotional period for my family each time he goes to the hospital. So I grew up with that like motivation to be part of the people that promote health. And also when I was in secondary school, I now saw a group of nurses that came to give us health talk, and they so inspired me that I want to be like them, promoting health in the community. And I think that remains to be one of the main reasons why I joined nursing, and has also remained one of the main reasons why I want to promote health even till today. I still want to go back to public health, and I'm still looking for ways, taking courses in the United States that will make me to be a public health nurse, work in public mental health nurse in the community and all of that. So that's basically the story behind my choosing to become a nurse. So my top two advice for people that want to move to the United States is to be patient and to start somewhere. So the process of moving from Africa, for example, to the United States usually is lengthy because the immigration process is different from passing the exam. So, and you don't just walk in to write the exam, you also have to go through the CGFNS, that they will have to verify your document, your studies, your experience and all of that. So when you pass through that, then they will authorize you to write the NCLEX exam, which is the nursing exam for the United States. And also after you have passed that, then they will start working on your immigration, and that makes the whole process for most people is the average is from 1.5 years to 3 years. I've seen people that we are in the process for 4 or 5 years. So I would say if you really want to work in the United States, you have to be patient, and then you also need to start somewhere. Some people, they will look at the whole process, and then they will just feel like it's so lengthy, they don't want to do it at all. And again, I would say that if you start somewhere and you are seeing little progress, then you will keep that motivation. And even when it takes long, you know that someday you are going to find yourself in the United States. And I believe it's worth it. It's worth the wait, and it's worth the patience, and it's worth the effort. Another thing that I've seen people do is that there are so many countries that are easier to move to, and those countries will help you to develop the skills and also develop the international experience that is also very valuable to people that want to work in the United States. So moving to the UK definitely helped me to gain experience, and I had opportunity to now connect with other agencies that will want to help me to achieve my goal of working in the United States. So the top two tips is to be patient and to start from somewhere. Little progress will actually help you to get there. So to pass my NCLEX, because I'm already a registered nurse, I already have that background knowledge and all of that. But sometimes when you see in the media that NCLEX is difficult, a lot of people fail and all of that, it becomes a little bit scary. But for me, I believe that what helped me to pass was being consistent. Like when I now said, okay, I'm going to write my NCLEX, I chose to work in London so that I don't have to travel. It won't be one of the things that I'm worried about, because I know they have a center there. So I decided to start, studying consistently. When I'm going to work in the train, I try to study, and then when I'm practicing in the ward, I use that time to study my pharmacology. If I don't if I encounter any medication and I don't know, any diagnosis that I don't know before, I'm not familiar with, or anything, I'll try to read it up at that time, try to ask people questions. For my EKG, I remember asking doctors, what do you think this reading is, and all of that. So studying consistently and trying to apply those knowledge in the clinical area definitely helped me. Again, is the question banks. So when I have already covered the basis, like I was reading the Sundance and all of that, I decided to also incorporate Mark Klimek audios. He also has a YouTube channel, and also U-Word questions. They were really, really helpful. The question banks, if I'm going on a train, on a bus, I try to go through some of those question banks. I have family at home, so usually I have that distraction at home, but that consistency of reading in the bus, practicing in the clinical area and all of that really, really helped me to pass my NCLEX. Okay, so like I have mentioned before, how the process for the US, I usually say there are three parts. The first part is verifying your documents with CGFNS. That's what I did. Verified my documents with CGFNS. This usually involves like contacting my NMC, my NMC in the Nigeria, NMCN, we call it NMCN in Nigeria, to send my documents, my license information to CGFNS. And also I needed to also send that of the UK as well to CGFNS. And then once they have gone through the documents and all of that, they give you authorization to start test. So once they have gone through the document and gives the authorization to test, then I went ahead to now write my NCLEX. And then, okay, as they are going through the documents and all of that, that was the time I was getting ready for my NCLEX. And once I got the authorization to test from CGFNS, I booked my NCLEX exam. And then once I passed the NCLEX exam, the agency that I use now started working on the immigration for me and my family. Once the immigration finished, and then I was able to move to the United States with my family. So those are the processes basically. First of all, if you decide that you want to move to the United States today, the first is to go through the CGFNS. I believe there are other bodies as well that are beginning to help with this verification process, and then go pass your NCLEX, and then go through the immigration, and then you find yourself in the United States. I decided to move to the United Kingdom first because it appeared to be an easier process, and I noticed that when I work in the United Kingdom, I'll be able to gain the skills, the international experience. And I also had this idea that when I get to the United Kingdom, that if I notice that I can study as well, because it's one of my main goals of traveling abroad, if I know that I can study, I can progress my career, I'll be able to work in an area that I really like. So maybe I may even change my mind from going to the United States. So when I got to the UK, which was obviously easier, it took me like about 6 months for the whole process to be completed. But then I also had that in mind of choosing a proper place in the UK where I'll be able to write the NCLEX if I decide to move on with my dream of going to the US. So I chose to work in London, and while in London, within that 6 months, I quickly decided whether I will be able to study or not, whether this will actually give me the I'll be able to achieve my goals, what I had in mind. But during that 6 months, I determined that I still want to go to the United States. So I started practicing for my NCLEX right away. I started verifying my documents and all of that. So basically, it's just the ease of transition, moving to another country. Here in the United States, I've noticed that a lot of people also move to the Ireland, to UAE, to Dubai, to the UK before moving to the US, and they all said that it's a bit easier to do it that way as well. Yes, I usually get this question a lot. A lot of people want to know the difference, and I actually feel that there is a clear difference between working in Nigeria, working in the UK, and working in the United States. Nurses in Nigeria, where you work, actually determines how much expectation, like if you're working in a private hospital that is mostly where the leadership is mostly the doctors, they'll be the one to tell you exactly what you are supposed to do. And then if you're working in a teaching hospital, then your job description might be a little bit different. It's the same across board, what you do as a nurse and what you already know as a nurse. The only thing is that the expectation is different. In Nigeria, it depends on where you work, whether you work in a private hospital or you work in a teaching hospital. So what you are expected to do as a nurse will be different. So in the UK, what I have noticed is that they have their doctors do some of the things that nurses in the United States are expected to do. So their doctors will be the one following up the labs, and if a patient deteriorates or something, you as a nurse, you need to do the assessment and call the doctor, and the doctor will have to do their own assessment as well. But in the United States, nurses are involved in the admission, they are involved in the labs, making sure that the labs are okay, telling the doctors, even contributing, suggesting what you feel will be good. And sometimes doctors put all those things into consideration. I would say most of the time they put all those things into consideration. So it makes nursing in the US a bit unique, because nurses it looks as if they have more say than other nurses in Nigeria and in the UK, but ultimately the basics are the same. It's just the expectations that are different in the three countries. That's my own experience, because people will have different opinions and experiences as well. Oh yeah, when I moved to the United Kingdom, I started getting a lot of requests from friends how they can also go through the process and move to the United Kingdom. And I remember I always get on the phone with them and explain the process. So some people wanted to find out what it feels like working in the UK. So I find myself always answering the same questions. So at some point I decided to start making videos of how I passed my IELTS here, or what it is like working in the UK, how to work in the UK as a nurse, the agencies to use, or to the hospitals that are hiring. And people kept requesting for such videos, and that's how basically I started my YouTube channel. So here right now in my YouTube channel, I just dedicate it to like sharing information on how people can work, study and thrive abroad. Oh yeah, I miss a lot of things about my home country. I miss my family, of course, and I miss the food. I miss the weather. I miss the warmth. I miss going for weddings, for being invited for child dedication and all of that. Here in the US and while I was in the UK, I was still trying to know people, and the friends that I have here abroad, when I am not working, they are working. When they are working, I'm not working. So it's very hard to connect with people, to make friends. But I'm beginning to, connect with organizations, trying to just make sure that I'm not isolated. So definitely I miss all the activities back home, the food, my people. But I believe I'll get there soon here as well. One thing I love about this particular place I live in, Texas, is the warmth. I'm able to say hello to people and they respond, greet people and they respond. And again, they are interested in knowing my experiences where I have worked before, without making me feel like I'm a stranger. Overall, they have been welcoming, and the weather here is also very, very good. So those are the two things I really, really love about Texas: the warmth from the people and the weather. Yes, I really, really want to encourage nurses out there that want to work in the United States or work in the UK or anywhere else apart from their home country, to just go for it. Working abroad actually opens up doors of opportunities for you to grow in your career, to network with people, to learn more, and you'll be able to make an impact not just in your home country but in another country as well. It also helps your family as well, because they will be able to have that opportunity to also get international education, the network and all of that. So I would say, if you have that dream of traveling abroad, go for it. And if it is for challenges, yes, you are going to encounter challenges. You are going to work with people that are mean, that don't like you for various reasons, that will try to bully you. But one thing I know about nursing that is really good is that nursing gives you the platform to be anything that you want to be. If you decide that med-surg is not good for you, there is public health, there is mental health, there is informatics, there are so many. You can be an entrepreneur, you can mentor other people, you can be a nurse educator, you can be a researcher. So if one area is not good for you, even when you move abroad, just know that your experiences back home also counts, and you can use it to venture into other areas, even in nursing. So if you want to work abroad, go for it. And when you eventually get to any country that you like, and you find yourself in an environment where you are regretting traveling abroad, or you don't like that place you work, just know that you have other options. You can take courses and just move to another area that will help you, that will give you the peace of mind, that will be able to make the kind of impact that you want to make. So at the end of the day, I am grateful to be here, and I encourage everyone to go for their dream, to be the best nurse that they can be, and to contribute in any little way they can to their various communities. Thank you so much.